All right, it's that time of the week again, answering your common health questions. Joining me as always, News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. I have a couple of questions for you today, and one is something you might not think about a lot. Can a child have a stroke?
Yeah, unfortunately they can, but fortunately it's very rare. It only occurs maybe in 1 to 2 children for every 100,000 worldwide. Wow. And the same pathology is present. You have your ischemic and you have your hemorrhagic. The most common causes in ischemic are going to be congenital heart disease, a hole in the heart, infection, and most commonly it's going to be sickle cell disease. The blood in the brain or hemorrhagic, it's going to be from either head injuries or it could be from a congenital malformation of the blood vessels within the brain that can burst.
Right.
Either way, the symptoms are very similar: acute onset of weakness, slurred speech, or even seizures. And if any of those occur, make sure you get them to us in the emergency department real quick so that we can evaluate.
Same symptoms as you would see in an adult.
Yes, you would.
All right, let's go to our second question now. How common is it for children to get ear infections?
It's actually unbelievably common. Matter of fact, it's the cause of the most pediatric visits. Wow. Second only to child visits. It accounts for about 30 million visits per year.
I remember having one as a child.
You got
it was painful.
We all have.
Yeah.
But the reality is that the most common causes are common cold, sinusitis, allergies, and what happens is it obstructs the eustachian tube, which is the tube between the eardrum and the nose. That gets occluded and bacteria can get in. So the real question is how often does that result in antibiotics, and are they necessary every time? Remember, you're going to get about 5 to 7 of these colds every year. Wow. If you put your child on antibiotics or a course of antibiotics every time, it may be unnecessary. So I want to make sure that the parent always asks the question, because the doctor's going to want to act most conservatively. Ask the question, Doc, is it necessary for him or her to be on antibiotics this time? Because that opens up the discussion and allows possibly the elimination or the prevention of getting antibiotics when they're not needed. So please do that.
All right, and hopefully get it treated, because those can be painful for kids for sure. Maybe you have a question for Dr. Soria. Send it in to our website, WPTV.com. Click on the health link. Just scroll down on the right-hand side. You see there, you'll see a form to write your question. All right, as always, thanks for coming in, Doctor.
You're welcome,
We'll see you next Wednesday at this time, and we'll see you right after the break.